So what are the steps of getting a new smile or getting cosmetic treatment done? We offer complimentary discussion visits so that people can really come in and get an idea of what the possible options are and also the ballpark figure of cost too. If they then decide to go ahead, we will book a consultation visit. And the consultation visit involves us looking in their mouth, taking x-rays, taking photographs and taking videos, and really writing down a treatment plan for the patient. So the patient will actually get a written quote of all the possible options and also know exactly what the costs are after that visit. If they decide to proceed, that's when we go into, I suppose, the cosmetic treatment, and we will sit down with the patient and actually do what we call a smile design. A smile design means that we get an idea of what the patients want from their smile. They can bring in old photographs of their smile, they can bring in magazine clippings, they may even download things from the internet. And this information is critical to tell us what they like about a smile. That information and the photos that we've taken, we actually go back and analyse the photos. So we do a digital smile design. We will actually design the smile on a computer system that matches what they've actually asked for. We then also use that to do a digital mock-up, which means that there's a photograph with their new smile actually in, and this allows us to ensure that the communication is correct. Those models and those photographs are then used by the technician to actually design a smile. So by visit 2, which is really the consultation, to visit 3, we have already planned and designed the smile, and the patients get to see that mock-up on a model. So the visit 3 really is just confirmation that they know what we're actually doing, they know the design of the teeth, and they get to see a model of their mouth or a model of the new teeth in wax. If they're happy with that model, and if they're not, we can always make changes. If they're happy with that model, then we will book for treatment. So treatment can be done while the patient's asleep, while the patient's awake. And what we do at that visit is we do the preparation of the teeth and any treatment that needs to be done while the patient's asleep, and we then fit the trial smile. So the patient at that visit will actually wake up with the smile or a trial smile in their mouth. They would then actually go home and come back within the next week or so to give us an idea if they're happy with that trial smile. So we can check things like the appearance, the colour, the shape, the position of the teeth, the phonetics to make sure when they speak everything's correct. And if everything's correct or if anything needs modification, we will of course do at that visit. And then we know that the patient's 100% happy with the trial smile. We will take more photos and more models of that case, and that would then go to the technician for the final porcelain to be made. The final porcelain is reviewed at the next visit from the patient, and then we would put the porcelain in at that visit. So in summary, it would be complimentary discussion visit to find out what the possible options are and also ballpark figure of the cost. They would then decide to book a full consultation, which means we're collecting data and planning things. We then get to look at a model or a trial smile, so that's visit 3, checking the trial smile and making sure everything's fine. If they're happy with that at visit 3, visit 4, which is the actual treatment visit, can be done while the patient's awake or while they're asleep. They get to then review the trial smiles to make sure they're happy, and then we have one more visit to basically finish the final porcelain. With all of these steps, the idea is to get good communication so that the results that we achieve is exactly what the patients have actually asked for.